Welcome everyone. Dr. Mandell here with you. I hope everyone out there is having a pleasant morning, afternoon, or night, regardless of where you are worldwide. Today's topic is going to be all about the Scalenus trigger points. Scalenus muscles are these muscles in here. These are so much directly related to so many neck, head, shoulder, arm, mid-back problems. Probably one of the key muscles out of all the muscles in the neck that can refer the funniest kinds of symptoms. When I say funny, the unfortunate funny, meaning that painful symptoms that people are not catching. So I wanted to go into a little bit about this and show you how you can correct these conditions. A great amount of people who are my subscribers here have neck-related conditions, either a disc, herniated disc, and you may be told that you have a disc herniation. It may not be coming at all from that disc herniation. So let's get right to it. Let's not waste any time. Let's look right here. We're looking at these scalenus muscles. There are three portions of the scalenus muscles, and relax. I will show you exactly where they're at, how to contact them, what to do, and while doing this technique, I'm hoping you see like immediate results. It's kind of cool. The body is very intelligent. We have the anterior, middle, and posterior scalenus. These little yellow dots in those muscles are the trigger points that we're more or less after, but they can happen anywhere in the muscle. But just to give you an idea a little bit about trigger points, we'll explain that to you. But this is the referred pain. So in other words, when you have these trigger points are noxious points that are tender, they're lumpy. This is an irritated point within the body. The body responds by sending referred pain to a different part of the body as a result of these trigger points. So our job is to locate these trigger points and remove these trigger points so we can remove our other symptoms. It may be leading to our head, our headaches, our neck, our arm pain. And I'm going to show you something really interesting. I think you'll appreciate this. So these are the main areas. Primarily in the upper extremity, commonly into the chest, very common into the arm. Well, I'll explain why. Even into these fingers and here, people can sometimes get confused with carpal tunnel syndrome, maybe coming from the scalenus that's contracting. And I'll explain the thoracic outlet syndrome, how this is intertwined. But primarily what's happening is we're getting muscular contraction, we're getting ischemia, which is a lack of blood supply, and we then get deficiency of nutrients. And it becomes a long-going process. And we start developing these knots, and these knots are hidden because no one is ever addressing them. So when we look at the trigger point complex, we're looking at these nodules or tight bands. How many times someone came up there and kind of put their finger right here and said, wow, it's lumpy. And when they hit that, guess what? What do? Ah. And while they're rubbing that, does this sound familiar? I feel it over here now. In other words, they're rubbing a point here, okay? And now you feel it here. Or they're rubbing a point in the side of the shoulder blade and you feel it kind of shift in front of your chest or maybe down your abdominal area. The body is all interconnected. It's all wired together. So we can hit one area and then we can obviously have symptoms or referred pain or referred symptoms while we're stimulating this point. So this is the contracted knot versus the normal fibers, and this is the trigger point complex. Don't worry so much about the physiology. It's not what we're here for. Here is just a little anatomy. The key component that we're looking for today is the SCM. That's our landmark, the sternocleidomastoid. Watch here when I look this way. See that muscle? And then if I push my head against my hand like this, it comes out more. That's our landmark, okay? Once you find that landmark, which I'll get to in just a second, that's where we're going to contact. Now, if you looked at SCM muscle, called the sternocleidomastoid muscle, right behind it are those scalenus muscles. To the left, you see anterior, middle, and posterior. Those are the muscles that are hidden back behind that SCM muscle. Now, right behind those scalenus muscles is the levator scapula, as well as the trap muscles and the splenius cervicus muscle. But for our purpose here, we're only concerned with the scalenus muscles because these are the primary muscles that we hopefully can reduce those trigger points, because I'm sure many people have these conditions. But remember, the scalenus muscles, when they contract, they generally do this. Okay, they pull your head to the side. And the reason why these muscles are so involved is from our poor posture, from sleeping with the head up, propped up or propped down. Just postural activities does cause these muscles to contract. Anytime we have a muscle that's irritable or contracted, we develop trigger points. It becomes a whole vicious cycle of oxygen and circulation and noxious substances. But let's look at this picture right here. You see that anterior scalenus muscle in the front, and then you look at right behind there. It says a scalene muscle. It's supposed to be triangle. I took that off the net. It says tangle. It should be triangle. Maybe they have tangle, whatever that means, but it should be a triangle. But you see those nerves that come out like that, those yellow nerves? Guess what? That's your brachial plexus. So between the anterior and the middle scalenus, that brachial plexus comes out, and that's what runs down your shoulder, right down your arm into your hand and fingers. So if those scalenus muscles are just contracted, that is a form of thoracic outlet syndrome, that those muscles are just squeezing on not only the nerves, but you have the neurovascular bundle, which is the vessels and the nerves that run all together. So when it squeezes like this, it's going to shut off oxygen as well as nerve supply. So you can get the tingling, the numbness. Now you can feel referred pain in your chest, between your mid-back, and it becomes a very complex cycle because those nerves, actually I was reading some studies about people having difficulty swallowing, like a constant tickle in their throat, because these nerves all innervate those areas. So it's kind of amazing how intricate the body is, but our job is to let things work properly so we can heal fast and naturally. Okay, so this takes us to our grand finale here. This is the Bermuda Triangle. Okay, as I said here, I don't know what I called it. It says a Scalenus triangle, but for our purpose here, this is really called the Bermuda Triangle. And what we're concerned with is that we're concerned with locating where it's at. Now, the key component is the sternocleidomastoid, the Scm muscle, which goes from the mastoid process here, and it makes its way to the clavicle as well as the sternal manubrium here, like this. There's two muscles that come. So what I want you to do first is turn your head to the left side. If you turn to the left, you'll feel the right SCM come out. You can take your hand, push it against your head and push against your hand, and it comes out more. See how that thick muscle is? Now, I want you to grab it down below. And as you grab it down below, let's look back again, okay? You grab it down below, and off to the outside of that muscle are the scalenus muscles. So when you grab it below, a lot of people teach it where you get your fingers in there and work it, but I'm going to show you what I like to do that's very simple. Particularly if you're at a desk, it's really easy to do. What I like to do is just set my arm down. Oh, you hear it banging there. And what I like to do is grab the muscle and then take my thumb behind that sternocleidomastoid muscle and get in there. All right, you're on the scalenus muscles, and you go in there and start gnawing around, little circular motions, not hard, but just pressure, acupressure. It's going to be so tender, those points. So I want you to just to hold on to that point that's tender. And while you're pushing it, you may notice, wow, I feel something go to my head. Just keep holding it, because that trigger point will soften up. And when it softens up, the pain will start to dissipate. But I want you to get in there and move around and play around with those muscles in there. Now, if you're in front of the SCM, if you're in front of the sternocleidomastoid, we don't want you to go to the carotid artery. Now, if you feel something throbbing, get off of that and get behind the SCM. Remember, turning off to the side, pushing against your hand, feeling the muscle just behind the muscle. Okay, that is the triangle. I take my thumb like this, right above the clavicle, and I work my way up. I hold it. It's tender, real tender here. Come to a different point. It's real tender. Just firm pressure on that muscle. And you'll usually feel maybe something refer to your face, maybe down into the shoulder, maybe into the throat, or you may start to notice the pain that you're having starts to diminish. Now, if you get in there and that pain starts to diminish, let's say I'm doing this and I notice between my shoulder blades or to the right scapula, that pain eases, or I notice the pressure eases, or I notice that the pain on my other side of behind my neck starts to ease. I want you to focus in that area and just press in those points, because they're going to be tender. And if they're not tender, you're not on the trigger point. So remember, there are different muscles. There's anterior, middle, and posterior. But towards the front, you'll work more of the front ones, and you come back a little bit, and then you'll kind of work your way up behind that SCM muscle, and just take your thumb like this and just lean your head over it. That's it. Just lean into it and come to a different area and just lean into it. And right now, I feel something referring right here. Okay? But as I hold it, it starts to diminish. So don't be panicky if you feel the pain while you're holding it. That means you're on it. Okay? But you don't want to overly push and overly stimulate it because you don't want to bruise it. You can do this several times a day. Do it a couple minutes each time. Your condition should continue to get better and better and better. I really would be interested to know exactly how this has helped you. Remember, this area goes to the shoulder, down the arm, into the fingers. It goes to the chest. It goes between the mid-back, commonly into the head and into the neck area. And this can really take away a lot of your symptoms and hopefully help you, because even though you've been diagnosed with osteoarthritis, degenerative joint disease, degenerative disc disease, herniated disc, bulging disc, whatever it is, herniated disc, it doesn't matter. The bottom line is many of these symptoms mimic those herniated discs from these scalenus muscles, particularly pain or tingling into the arm and hand. Share this video on your social media. I hope that you can really help me reach out to share these videos. This is really a great video. Check me out, Motivational Doc, on my channel, as well as Facebook, Motivational Doc. Leave your comments or reviews. And I really hope this makes a big change in your life. Remember, if we can get off drugs, get off these narcotics, save our organs and tissues like our liver and kidney from these anti-inflammatories, these non-steroidal anti-inflammatories, and these other drugs, we are really helping preserve our life and keeping ourselves healthy. That's what it's all about. Blessings to everyone, and we'll continue to educate you. Most important, make it a great day. Bye-bye now.